Dr. Aznavour, tell us about flossing.
Well, flossing is one of the most important, if not the most important, way to get your teeth clean and prevent cavities and gum disease. What you should look into floss. Well, there's a few types of floss. There's wax floss, tape floss. Just look into which one works better for you. Each one is for a different preference. Each person is different. The most important thing is to be able to floss every day. It's very important. When you floss, don't be too aggressive. You should just pass it between the teeth and go up 3 times between each tooth, and you can either pull it down or pull it out the side. Another issue is people are saying, oh, I have a gap between my teeth, I don't have to floss. That's not necessarily true. That is true on children who have gaps between their teeth. Then it's not as necessary to floss because the brush will get in there. But on adults, it's always necessary to brush to get it between your gum and your tooth to get any bacteria that's out, any plaque that is out. There's a couple of flosses. There's super floss, which is a little thicker for people who have big gaps. And then there's floss threaders for people who have bridges, who are not able to floss properly. That is very important because underneath the bridge, you can always get food stuck, which can cause cavity on the adjacent tooth that's holding that bridge. Very important. Floss threaders are very important and should be used on a daily basis. Another issue is, I have crowns. I don't need to floss. There's no tooth underneath. That is absolutely not true. What's holding the crown is a tooth. I hear this every day. I thought there was no tooth underneath. There is a tooth, and it's one of the most common areas to get a cavity. It's the margin between the tooth and the crown meet, and that's where you get cavities, and that's usually due because of the lack of flossing.
I see. So flossing, again, very important to prevent gum disease, which we know is really devastating and can cause many other illnesses, and that's just not a good thing. All right, well, thanks a lot. Are there any type of flosses better than other ones, flavored, not flavored, or any big, small? Is there, like with toothbrush, is there anything which people should maybe look out or not necessarily? Doesn't matter.
The only one I usually don't recommend is the one that's like a toothpick and it's got a string that's going across. Those can damage your gums. Although it's better to use that than not floss at all, but nevertheless, if you're going to floss, you can use either the tape or the waxed or the unwaxed, whatever works best for you.
Why would the toothpick one be not so good? The reason I'm asking
that's because you can't
used it.
Well, sometimes you've used it. If you've got a big gap, it's okay. The only problem with that is that, for example, a regular floss, you're able to wrap it around the tooth. When you go up, you wrap it around the tooth. With a regular straight floss, the one that is on a plastic pick, it can only go straight. It's not flexible like a regular floss. And that's why I usually don't recommend the straight floss, although it's, like I said, it's better than not flossing at all.
Got it. Okay, wonderful. Okay, I also heard some people, especially, I have traveled to many countries, and one of them in India, and there's lots of people there who have a tongue scraper. Does that have anything to do with, and dentists are the ones who recommend it, does that have anything to do with flossing, not flossing? Is that something totally different, a subject in itself, and something unnecessarily? What's the deal there?
No, that's a very good point. You can use your regular toothbrush to brush your tongue. You should brush your tongue once a day because bacteria can go on the tongue. Now, it has nothing to do with flossing. It has more to do with the brushing. When you're brushing your teeth, brush your tongue, because what you have is papilla, is what it's called on the tongue. And if you don't brush it, papilla, it looks like hair that grows on the tongue. And just like any other substance that can accumulate, bacteria will accumulate. If it's hair, it's not hair really, but it's called papilla, and it grows. And bacteria can adhere to it. And if you don't brush it and you let that grow, it can cause a bad odor. Okay, it's an accumulation of bacteria. Okay, and it can, it's not healthy for you. So you should brush your tongue to remove that papilla and make sure that your tongue isn't white. You want to make sure that you get it evaluated if you have any white lesions on your tongue by a professional.
Well, thanks a lot. We'll speak to you soon.
Sure.